Welcome to Health Science Portal podcast on transplantation, gynecology, and obstetrics scientific articles. This is LJGomes, December 12, 2018. A letter to whom it may concern. It was published in the medical journal The Lancet, an article about the first world uterine transplantation from a deceased donor, which was performed at the University of São Paulo in São Paulo, Brazil, in September 2016. Congratulations to Dr. Dani Ejzenberg and team for this medical milestone. The donor was a 45-year-old lady with an obstetric history of 3 previous natural deliveries, with 3 or 3 parturitions, who unfortunately passed away from a stroke. And the recipient was a 32-year-old lady who was born with an uterine anomaly or without uterus due to a disorder called Mayer-Rokitansky-Kuster-Hauser syndrome or MRKH syndrome, a congenital malformation. According to the scientific literature, the core signs and symptoms are related to a genetic disorder with an autosomal dominant inheritance pattern and variable expressivity involve a set of genes. The WNG4 gene found on the short arm or P-arm of the chromosome number 1 encodes a protein named WNT4 protein, which is secreted, removes steroidogenic enzymes such as the 17-alpha hydroxylase and therefore leads to an excess of androgens. Thus, it is described to be present in a typical case of Rokitansky syndrome associated to hyperandrogenism. There is a genetic mutation which changes the amino acid leucine in the position 12 to the amino acid proline and therefore alters the protein, leading to the lack of the protein WNT4. Moreover, the WNT4 protein is involved in the formation of the Mullerian duct, a structure of the internal female reproductive system which forms the uterus, and the absence of the WNT4 protein can cause malformation or lack of the uterus during the embryonic development. Another name for the Mullerian duct mentioned previously is paramesonephric duct, and during the 13th week of the fetal period of the development after fertilization, it will form the uterus or womb. This syndrome, therefore, is also called Mullerian genesis for the uterine anomaly, and other degrees of genitourinary hurdles beyond body malformations include the renal and skeletal system. The ovary, where the ovulation occurs, is not affected once it is not originated from the Mullerian duct previously mentioned. That being said, the patient can ovulate, however. Due to the lack of uterus, she cannot get pregnant naturally, which justifies an intervention such as the transplantation described. Thus, after the uterine transplantation, she presented menses. The diagnosis and treatment are associated to the variable expressivity of the gene and disorder, and it accomplishes for 15% of cases of primary amenorrhea or the lack of menses up to 16 years of age. Epidemiologically speaking, is discussed the prevalence of the disorder in the population as well as the classification of the syndrome, and is estimated 1 in 4,500 live females' births. The technical hassles of the uterine transplantation were one of the questions the subscriber has been making since 2009 when studying clinical trials and projects in transplantation and immunology. The time spent for the transport of the organ donated to the hospital and its ischemia time, or the time the organ does not present circulating blood, was another discussion but justified all efforts and methodology improvements. Therefore, these procedures, which involves dead donors, opens up solutions in reproductive medicine in many cases, including this one regarding congenital malformations.